Some people hesitate to go to the emergency room after a sudden change in their health. Although your symptoms may be common or harmless, they can also be life-threatening. These 9 red flags are your body's way of telling you to schedule a checkup. Stay tuned with us. Number 9. Chest pain. In fact, burning chest pain could be a heart attack, the kind you often see on TV shows. So if you feel tightness in your chest, call 911. You should also call your doctor if the pain is less severe but reoccurs. And don't think that a heart attack is always felt in the chest. Symptoms such as back pain, nausea, jaw pain, or extreme fatigue may indicate heart problems. If any of these things happen to you, call 911 and say you have a heart attack. Number 8. Breast or nipple changes. Breast cancer is the second most common cancer in American women after skin cancer. More than 287,850 women are expected to be diagnosed with invasive breast cancer or carcinoma in situ, the earliest form of breast cancer, this year. Early detection is key to survival, although there is debate about when and how often to start screening. The American Cancer Society recommends that women between 40 and 44 start getting mammograms yearly. All women between the ages of 45 and 54 should have annual mammograms. Females at high risk of breast cancer should have breast MRIs and mammograms yearly, usually starting at age 30. Number 7. Severe headache. If your headache comes on suddenly and can only be described as the worst pain you've ever experienced in your life, call 911 right away. You may have an aneurysm, a weakened area in the wall of an artery that supplies blood to the brain. The pain comes from dilated arteries pressing on the brain. If it ruptures, you can have a stroke or, worse, die from a brain hemorrhage. Don't hesitate to call 911. It's not the same as a migraine. Still, similar symptoms can occur, including vomiting, sensitivity to light, and fainting. But the head will be so painful that you will hardly stand it. These can be symptoms of a brain tumor, vision problems, or many other factors. Number 6. Bloating and gas. The patient came to me after a major heart operation. Although her appetite hasn't really increased, she has been feeling bloated. However, she couldn't even close her pants. She explained that she thought it might have something to do with the surgery, maybe too much air in her intestines after being open on the operating table for so long. Barnes knew this red flag could mean something serious, so she ordered blood tests and an ultrasound. Her patient was diagnosed with ovarian cancer. "I'm worried about the new bloating and gas," says Dr. Parnas. "It's not a one-day change. It's a continuous change. Contact your doctor if you experience unusual bloating, loss of appetite, postmenopausal bleeding, or changes in bowel habits." Number 5. Numbness of hands and feet. If you experience numbness, weakness, or tingling in your arms or legs, or if you lose strength, for example, if you have trouble walking upstairs, you may have a herniated or bulging disc in one of your vertebrae that is compressing your nerves. This nerve can be damaged. If the pressure on the nerve is not relieved, it can eventually cause permanent changes or damage to the nerve. Call your orthopedist or neurologist to discuss treatment options. Often, doctors wait to see if these symptoms go away on their own. But in the meantime, you may need physical therapy, NSAIDs, heat and ice, or cortisone injections. If these treatments don't work, you may need surgery. In any case, don't wait for it to be noticed. To stay up to date with our latest videos, make sure to subscribe and press the notification bell button to get some interesting stuff in upcoming videos. Number 4. Painful and swollen legs. If you notice calf swelling with painful tenderness in this area, contact your doctor or go to the nearest emergency room. It needs immediate attention. It's not something you should expect. These symptoms indicate that you have a blood clot in your leg, which is a dangerous condition because it can be fatal if it breaks off and travels to your lungs. Pulmonary embolism kills about 200,000 people each year, according to the Society for Interventional Radiology, which tracks such statistics. Blood clots can block the supply of oxygen to the lungs. However, if treated quickly, Usually with blood thinners and close monitoring, the mortality rate is less than 10%. Patients with a history of blood clots are most susceptible. Still, anyone who is immobile for long periods can develop a blood clot. Other symptoms include shortness of breath, discoloration of the legs, more visible veins, and warmth in the legs. Number 3. Constant cough. You should contact your doctor if you cannot get rid of your cough. A persistent cough can mean many things. Possible diagnoses include an infection, cardiac distress, cancer of some type, bronchial or lung problems, gastrointestinal reflux disease, GIRD. Number 2. Excessive fatigue. Everyone has different energy levels, especially as we get older. But if you suddenly find yourself unable to keep up with your life, your body may be trying to tell you something. Your doctor can test for anemia. You may have Lyme disease or a malignant tumor. Your hormones may be out of balance. This could be a symptom of a heart attack. In any case, don't ignore it. See your doctor so they can rule out the cause of the drowsiness. It can be a simple problem that can be fixed so you can feel like your old self in no time. Number 1. Bleeding after menopause. If you're bleeding when you shouldn't, something's wrong. People often use the term breakthrough bleeding, but it's actually a problem with the pill. If you have bleeding in the middle of your cycle and you are not taking birth control pills, this is not normal. If you are perimenopausal, your periods may be closer or further apart, but you should not bleed during your period. Patients come to me and say, "I feel like I'm exercising too much." "You don't bleed from exercise," she said. But endometrial polyps can cause bleeding. It can be caused by imbalanced hormones. A shrinking uterus can cause bleeding. This may be a sign of endometrial cancer. When you go to the doctor, you will have tests that can rule out all these factors. Or it could be a journey to a life-saving diagnosis. While no one wants to get sick, it happens to all of us from time to time. One thing that all of these symptoms have in common is that acting quickly increases your chances of survival. Some things can't wait until tomorrow or next week. Go to the doctor now. Have you experienced any of these symptoms? Don't hesitate to leave a comment and share your ideas with us. Thank you, guys, for watching.